I'm Shawna Rosner, your host of In-House Counsel Chronicles. Today, my guest is Tim Gutwald. Tim received his BA from Kalamazoo College and his JD from Michigan State College of Law. Tim has been practicing law both in private practice and as an in-house attorney for 18 years. For the last 3 years, Tim has been general counsel and chief compliance officer of Mentavi, a telehealth company I'm going to have Tim talk about in just a minute. Welcome to the podcast, Tim.
Thank you, Shawna. Great to be here.
Happy to have you. So tell us a little bit about Mentavi, if you will.
Absolutely. So Mentavi is a telemedicine company, as you mentioned, based in Grand Rapids, Michigan. We focus on providing mental health care for any number of conditions, and we provide those services all across the country. We diagnose in all 50 states, and then we provide medical treatment, via medication or therapy and things like that in 42 states. We also offer coaching as well. And so we kind of have a unique approach to mental health care in that we offer a diagnostic evaluation assessment that is, people can take asynchronously. That's then sent to a licensed psychologist who reviews the answers, asks any follow-up questions they need, and then they provide a comprehensive report that will include any appropriate diagnoses. And so, patients can then take that to their PCP, a local healthcare provider, psychologist, psychiatrist, or they can come see one of our network providers, whether, again, that's a coach, a social worker, or a medical doctor to start treatment.
Great. And I know in doing some research for this podcast, I saw that Mentavi launched and has recently announced results for a real world validation study. I was hoping you could share a little bit about this, your role, if any, in this, and why it's so important.
Yeah, something we were very excited about. We wrapped up towards the end of last year. Was a study. What we wanted to do was show that sort of this asynchronous process was just as reliable and consistent as the more traditional kind of clinical interviews. So often, if you're going to get a diagnosis, in this case, we were validating for ADHD in adults. So there's a number of ways that you can get tested for ADHD, but typically there's a clinical interview, a face-to-face clinical interview with a psychologist. And so we had individuals do a virtual face-to-face interview with a set of questions from psychologists. They rendered a diagnosis. And then after that, we had people take our asynchronous assessment that was then reviewed and by one of our psychologists, and again, rendered a diagnosis. And so what we found is that there was a high degree of reliability between the two methods. And in fact, our asynchronous assessment was a little bit more conservative in diagnosing ADHD in adults than the in-person exam. So, we have interesting theories about that. We'll have to do kind of follow-up studies to see exactly why that might be the case. But overall, we were very pleased with that. We're looking to have the study published here in the upcoming months. Our chief medical officer, Barry Herman, is going to go to the International ADHD Symposium and present on that. And we're going to present the paper at a few other conferences as well. So as far as my role, early on, it was primarily advising people that, clinical research is a highly regulated field, like much of healthcare law. And so, we had to get the proper consents from people. We had to make the proper disclosures. We had to be careful how we market and recruit people. And so I said, that's not really my area of expertise. I do have some clinical trial experience, but, given my other responsibilities, we felt it best to outsource it to you can hire an IRB. There's independent IRBs, independent review boards that you can contract with, and they really help handle all of that. And we also worked with another company to help design the study and things like that. So given all the complexities, we felt it was best to use sort of outside sources to manage most of that.
Yeah, very interesting. And the results sound really promising for you guys.
Yeah. We're trying to find some grants to be able to validate, how we diagnose PTSD and depression, also for, ADHD in children. We recently launched another, it's called a snapshot. And it's a way for people, they can take it, they get a year subscription, they can take it as often as they want and kind of track their mental health and see how it goes up and down over the course of the year and see what sort of interventions help them and improve their mental health. And so we'd like to do some studies around that as well. So hopefully it's just kind of the first of many studies.
Wow, I find that fascinating. Not only do I have a law degree, but also a counseling degree. So all of this really is interesting to me. I want to get back into your role there in a few minutes, but first, I wanted to ask you about your journey to getting to where you are. You've been practicing in the area of healthcare since you became an attorney, right?
Yes. Yeah. So, um, yeah, I mean, when I was in law school, I was convinced I wanted to be a litigator. And so that was kind of my focus. And my first job out of law school was at a medical malpractice defense law firm. And so I enjoyed that. I enjoyed the science. I enjoyed working with doctors. And I enjoyed the sort of the challenge of doing depositions and cross examinations of experts. Physicians, but I did have the opportunity to work on an EMTALA case, an Emergency Medical Treatment and Labor Act is what EMTALA stands for. And so that law says, someone shows up at your emergency room, you have to provide a certain kind of base level of care. You can't discriminate based on who has insurance, who doesn't, and kind of kick people out. So I found it super fascinating and I really liked it. I published an article on it. And then that kind of opened some doors to work at a different law firm. So I joined Hall Render. I had a chance to do a secondment for about a year and a half with a large health system. And again, I really enjoyed that. Returned back to private practice for the next number of years. And then, worked with all sorts of different providers, mental health providers, large health systems, multi-specialty physician groups. And then one of the groups that became a client was, it was ADHD Online was the name of the company at the time, but it's now Mentavi. And they were looking for kind of someone to come in a few days a week as they started to expand where they're practicing, make sure that they were doing things correctly from a legal and sort of healthcare compliance background. And they just kept growing. And it was a lot of fun to be part of this rapidly growing company. It was a challenging area of work and, kind of a burgeoning area of telehealth. And so they eventually got so busy, they wanted me to come in full time. And so that's what I did. And I've been there for a number, 3-4 years now.
Okay, that's great. I work with companies looking to hire their first in-house counsel, and I want to spend some time talking about this. What's it like to be the first in-house counsel? I imagine there's challenges and there's things that you accomplish and are really rewarding. What can you share?
Yeah, I mean, I was blessed with, especially the CEO was really, wanted to do things very right, was very deferential and really relied on me. And when I said, hey, I think we need to do this, there wasn't a lot of pushback on doing that. So, that was thankfully, an easier part of the transition, but it is difficult to kind of, you come in, there's no contract templates. There's no compliance plan, like a formal compliance plan in place. And so it can be difficult to prioritize and know, okay, here's the highest risk place for the company. And this is what I need to focus on. And so, you're working with the executive team to kind of identify where you see those biggest risks are. You have to, align those with the strategy of the company. And so that's some of the challenges. And then the other challenge of a startup is that you generally don't have a large legal budget to rely on outside counsel and outside experts. And so you're kind of on your own, and that can be difficult at times. Fortunately, I have over the years developed a pretty good professional network of people that I can, ask a quick question to, but also you have to get comfortable learning new areas of law, new issues. Mentavi was a direct to consumer company, which is different than most of my others. So, learning about some of the laws about marketing and things like that were kind of new challenges that I had to get up to speed on.
Yeah, I wanted to ask you a little bit about that, taking on more responsibilities. I imagine you have since you started at Mentavi, correct?
Yeah, for sure.
And
Yeah, I
then
mean,
as a part of, yeah, go ahead.
it comes in lots of different ways. At different times, I've had some operational roles where I worked with sort of our medical assistant teams who work pretty closely with our doctors and kind of supervising them, which is helpful as a lawyer to kind of learn, what are they doing on a day-to-day basis? What are the legal risks associated with that? Another area where I took on more responsibilities had to do with kind of fundraising. Investors, especially in this space, there's been a lot of scrutiny on mental health and treatment of ADHD online and specifically. And so, being in on investor calls was definitely a responsibility that I didn't envision initially, but became, at different points when you're fundraising became, a fairly large part of what I was doing.
What do you what are you on those calls for? What's your role in that area?
Yeah, so there's a couple of our competitors had some legal troubles related to how they were operating and sort of a lack of compliance. And so investors regularly had questions about, what are you doing to make sure you're prescribing it appropriately and in compliance with DEA regulations, and making sure that you're avoiding diversion is a big concern with ADHD stimulant medications in particular. So how are you making sure that's not the case? So that's not happening. So those are kind of the typical questions.
Okay. And as part of your current position, I think you manage all data incidents and breaches. Did you come to Mentavi with experience in this area? And if not, how did you get the experience needed to be effective for the company in this area?
Yeah, so fortunately, that was an area that I had a fair amount of expertise in. I kind of started out with some minor data breaches back, when I was in private practice. And then I did have a couple of clients who had some larger incidents where like a laptop was stolen. And then, you have to make the disclosures to all of the patients. You have to do a press release to local newspapers, and you also have to tell HHS. That's assuming you're a covered entity, and then HHS will come in and investigate you. So I had that kind of experience, and fortunately, we've avoided a large data breach. And so we haven't had to deal with that, but we do have situations where an email is sent with the wrong person's name, or we have live chats with our support staff and customer services, and sometimes there's things like that that can happen. So they've been minor, and so those I've been pretty comfortable handling for sure.
Okay. Yeah, I didn't realize you had that background coming in. I can see where that would be really helpful. But you did mention that you're able to like kind of tap into, it sounded like, some of your network when you do have questions. And you also mentioned how you work with outside counsel. And I was curious how those relationships work for you. Are there trends you're seeing in the industry as it relates to how in-house operates or works with outside counsel?
Yeah, I mean that was an area that I didn't have. I was always on the outside working with working with the in-house counsel, and so it has been a transition, kind of learning, getting a budget from people and doing my best to hold them to that. Especially one of the areas that I didn't have a lot of experience on that I've gained a lot on is corporate governance issues, and we have like an option pool, and some of that was new to me. So I did rely on a colleague at my old law firm to help out with some of that. And that's a little easier when you have that kind of pre-existing relationship. I think, with outside counsel that you haven't worked before, it is important to have a lot of clarity, make sure your expectations of them are clear. Especially again in a company like mine where we don't have a large legal budget, making sure you set expectations around budget's important. So, I mean, at least in the healthcare field, there's been sort of, in my experience, been a consolidation. A lot of, because of all the hospitals are growing and buying some of the smaller hospitals, there's been more in-house counsel. And what I've seen in those relationships are really what in-house counsel are looking for: people with specific areas of expertise and very kind of specific experiences in sort of niche areas. And so that's typically where, I'm looking for some outside counsel to either an area that I just don't know at all, or where I have a little bit of experience, but just kind of want to make sure that someone who's been through the wars and has dealt with this for a longer period of time can help me out, and make sure that we're doing things right.
You mentioned that you work with, on a smaller budget due to the size of your company. So you do have to rely, you're relying on outside counsel, but within a budget. I'm curious if you have any insight as to when is a time when a company like yours would hire another in-house person. When would that make sense as a specialist or whatnot?
Yes. Yeah. I mean, certainly. I mean, I think it's probably a combination of, when you have the money for it, and what your general counsel, if you're starting to get into a new area where you don't have as much expertise. And so those are kind of the two areas where I see people expanding. We have hired, what we did is we haven't hired another attorney, but we have hired a vice president of compliance. And so that's been a significant help to me. She worked for a number of hospitals and health systems, and so she's able to handle a lot of more of those kind of data breach, those HIPAA type questions, and also been helpful in credentialing is another area where she had a lot of expertise. And so she's been able to help us build some more formality around how we vet the people that we're going to hire to be part of our provider network.
Okay, gotcha. And she reports to you, correct? So
Yeah,
that's
yeah.
a direct
And so that
report.
tends to be, it's that's tends to be a little bit more budget friendly to hire a compliance type person. And there's a number of, I was doing a fair amount of compliance work. I remain, still the chief compliance officer, but it's been extremely helpful, allowing me to focus a little bit more on the legal issues and some of the strategic things as opposed to some more of the day-to-day typical compliance issues.
Makes sense. And I wanted to ask you about, I saw from your resume that I was glancing at prior to this conversation that you have done a lot of presentations and you have a lot of publications. What can you share about that? How do you squeeze that in? When have you do that?
Yeah, I mean, like I mentioned earlier, and I got involved in the MTALA, and I thought it would be a good way to sort of get my name out there to some other law firms and kind of to beyond just the sort of the Detroit area that I was in, especially as I was trying to kind of transition from being a medical malpractice lawyer to a more general healthcare lawyer. And so I really enjoyed the process. I mean, I think like a lot of lawyers, you like the intellectual aspects of the job. You like learning new areas of law. And in healthcare, there's always new regulations coming out and always new laws that are being passed. And so there's a lot of opportunity. There's a lot of need to learn those areas. And so, I try to use it, especially in private practice, as a way to show, hey, I have some expertise in this, and, to try to help generate business. And then, some of it is that all my speaking, a lot of it is here in Michigan. I'm part of the healthcare law section for the State Bar of Michigan. And you sort of get, a reputation of agreeing to do those kind of things and being a decent speaker. And so they tend to just kind of go back to the same well over and over again. And I've also, like I said, I've often been on kind of some of the more cutting edge, like the telemedicine issues areas. And so people like to hear about those areas. And I end up getting a lot of opportunities to talk.
That's great. You took those opportunities and that you saw that kind of as a path to get to where you wanted to be,
Yeah,
right?
and I think it kind of doubles as a way for you kind of need to learn these areas of law anyways if you're in healthcare and you want to do that kind of work for your clients. And so it allows you to sort of double dip as you can get a little bit, you can build up your resume, meet some new people, get exposure to new clients perhaps, and also learn an area of law.
Yeah, I think that's really great. I'm glad you were able to share that and that you make time for that. I wanted to ask you about any advice you'd have if you went back in time and you were to give your younger self, maybe, just out of law school, a piece of advice, what would it be?
Yeah, I think it would be, and I actually just one of the talks I gave recently was to law students, and my advice in that was to really focus. So I wish I'd spent a little bit more time learning business law, general corporate law, because I think, especially as general counsel, you need to know at least the basics of those, probably better than I did. I was, like I said before, I was convinced I wanted to be a litigator. I wanted to be in court all of the time, and even if that had been the case, it still would have been beneficial for me to understand a little bit more about corporate governance and stocks and LLCs versus corporations and all of those things, because there's disputes about those too, right? And so I think I would have tell law students or young lawyers to make sure that you at least have a solid foundation in the corporate areas, the general business type law, because especially as a general counsel of a smaller, company, they rely on me for those sort of things. We can't go out of house all the time to how to call a board meeting, keeping board minutes, and all of those basic things. It'd be very inefficient to be paying an outside attorney to handle all of those things.
That's really great advice, something that I hadn't thought about. I could see where that would be beneficial. And so for you, it's just something that you kind of had to learn along the way, or did you have like a mentor or someone that helped you with that?
Yeah, I mean, it was mostly kind of learned along the way. I ended up at my last law firm, working a fair amount with the business group. They were doing a lot of M&A work with private equity and venture capital. And so in that capacity, you start learning about how deals are structured, holding companies and all of these different, and making sure you get all the votes, those sort of corporate purchase agreements and mergers and all that kind of general business stuff was something that I got sort of more and more exposure to by working on those kind of deals.
That's great. And then in close, I always like to ask this. What advice do you have for listeners who want to make a move in-house?
Yeah, I obviously in my case, it was by working, by finding a kind of a smaller company that was growing, building the relationship with the executive team, and then, as their need arose, I was kind of the natural next step for them, and I worked a lot with in-house counsel at, large health systems and physician practice groups, and so again, I think working closely with those individuals, building, friendships and working relationships with them so you get to understand exactly what they're doing on a day-to-day basis. And that usually will open some doors to do some of that work, especially if you're younger, and you think you want to ultimately end up in in-house counsel. Through those relationships, I was able to do some secondments for a couple of clients where either in-house lawyer left, or they were on like maternity leave or paternity leave, and so then I was able to kind of dip my toe in the in-house counsel waters there. So look for those opportunities. Firms often encourage associates to do those sort of things because one of two things happens: you get to know the company even better, or maybe you end up going in-house and then that work is coming back to the firm. So those are some thoughts that I have.
I think they're great thoughts. I think it's really good advice for anyone that's looking to go in house, and it worked for you. You kind of follow that advice and look where you are now. So I've really enjoyed having you on the podcast today, Tim. Thanks for being my guest.
I think it was a lot of fun, and it was nice to talk to you, Shawna.